Hi. Our job this week was to investigate how aspirin works on both a pathway level and a mechanistic level. So I drew these pictures, hopefully you can see them, of how the pathways work. The arachidonic acid undergoes metabolism by cyclooxygenase enzyme and forms prostaglandins, which play a very important role in inflammation and pain. Among the prostaglandins, PG12, PGF2, PGE2, and TXA2 have a very vital role to play. Let's focus on the TXA2, which binds the TXA2 receptor, a GC-based G protein coupled receptor, works by the activation of adenyl cyclase enzyme, resulting in the platelet aggregation. Aspirin works by acylation of serine residue in cyclooxygenase enzyme and prevents the formation of prostaglandins, thus overcoming pain and inflammation. At the same time, it inhibits the formation of TXA2, thus aspirin acts as an antiplatelet drug or antithrombotic drug. And it can be used in patients with cardiovascular diseases. Blood vessels are blocked by aggregates of platelets, resulting in the loss of oxygen to the heart. The mechanistic, that was the pathway level. The mechanistic level of inhibition of aspirin is shown here. Hopefully you can catch a glimpse of that there. And the aspirin acylitates the serine amino acid residue present in the active site of the cycloogenase enzyme, both 1 and 2 isoforms of cyclooxygenase enzyme. Aspirin is mostly non-selective, but mostly inhibits the COX-1 more than the COX-2. This is the structure of aspirin here. And then the structure of, I don't know if you can see, this is the structure of the 15-HTE, and that's here. The mechanism of acylation of COX-1 and 2 isoforms. The location of the serine residue in COX-1 and COX-2 varies. In COX-1, serine is present in the 530th position, and COX-2 in the 516th position. There's also a part 2 to this, and that is we are to explain prostaglandins, what prostaglandins do in respect to inflammation, and how inhibiting their formation would reduce inflammation. Prostaglandins are produced just in the same site as an injury occurs. They are produced by cyclooxygenases, and once made, they tend to attach to receptors that start inflammatory responses between some of the other effects in different kinds of tissues. They are the one molecule that signals inflammatory response, so when aspirin's acylacetic acid deactivates cyclooxygenases, the production of prostaglandin stops, so there is no inflammatory signaling in the receptors, thus no inflammation. Thank you.